What if having high cholesterol isn't your main diagnosis? What if high cholesterol is just another health issue that's been added to your other health issues? Which conditions should you prioritize, and can you manage all of them at once? One of the video topics I was asked to cover is how to manage high cholesterol when you also have type 2 diabetes and chronic kidney disease. The good news is that it is possible, and it's actually easier than you may think. Believe it or not, all of those chronic illnesses I mentioned are somewhat interlinked. Let me explain. Hypercholesterolemia, also known as high cholesterol. This is the presence of high cholesterol levels in the blood. Having too much LDL cholesterol causes a buildup of plaque in your arteries, which then leads to atherosclerosis. This causes the arteries to become narrowed and reduce the blood flow to the heart, therefore increasing your risk of cardiovascular disease such as heart disease and a stroke. Next chronic condition is diabetes. Diabetes is a chronic metabolic disease characterized by elevated levels of blood glucose or blood sugar. Having high blood sugars can actually speed up the progression of atherosclerosis. So much so that one of the interventions for diabetes management is to control your blood lipids. So that's your cholesterol levels and your triglycerides, to help to reduce the cardiovascular disease risk. Last one, chronic kidney disease is basically a gradual loss in your kidney function. The kidney's ability to filter blood is reduced, and wastes can build up to high levels in the blood, causing you to feel sick. Chronic kidney disease is actually a possible complication of poorly managed diabetes and can also increase the risk of cardiovascular disease. So we can see that everything is interlinked. By treating one problem, there's a domino effect and the other issues get better too. Of course, there's so much more detailed information about all of those illnesses, so I'd recommend that you do some reading in your own time. I'll leave some links in the description below. Let's look at some practical examples of how the solutions can also be interlinked. So we look at two examples. The first example of cholesterol lowering advice is to increase your fiber. So fiber helps to reduce the absorption of cholesterol from the bloodstream, therefore lowering your cholesterol levels. Eating more fiber is also recommended for diabetes management because it ensures that the carbohydrates are released into the blood at a more steady rate and preventing a sugar spike. And most people with chronic kidney disease are actually deficient in fiber. This is largely because foods that are high in fiber are also high in potassium and phosphorus, which often need to be reduced in people with chronic kidney disease. However, recent studies suggest the potential beneficial effects of dietary fiber for individuals with chronic kidney disease. Some important points from the studies I'd like to point out were that dietary fiber supplementation led to a reduction in serum urea and creatinine levels. So they're the clinical biomarkers that are used to monitor your kidney function to see how your kidneys are doing. Another point I'd like to point out is that increasing the fiber intake can actually slow down the reduction of the EGFR, which is how well the kidneys filter blood. Now, the second example, another piece of advice that's given to help you lower your cholesterol is to reduce your saturated fat intake. Research suggests that eating too much saturated fat in the diet can increase the amount of cholesterol in the blood. High intakes of saturated fat and processed meats are also associated with an increased risk of type 2 diabetes. And people with chronic kidney disease are at a higher risk of having a heart attack or stroke. Therefore, if you have chronic kidney disease, you should be particularly careful about how much saturated fat you are consuming. So as you can see, not only are the health issues interlinked, but so are the solutions. I hope you found this useful. Leave a comment below if you have any questions or ideas for upcoming videos. Thanks for watching. See you in 2 weeks.